Welcome to The Working World. I'm Keryn Mendez.
And I'm Jamie Lingham. Diversity and inclusion has been a huge subject for many, many years. Now, wondering how COVID has impacted these particular topics, our guest on this show is Dr. Dr.Lisa Interligi. She's a graduate of Monash University in Melbourne in Australia. She holds a doctorate in organisational psychology and is a member of the Australian Psychology Society. She's also a registered psychologist. Lisa has worked for 2 decades in organisational transformation and change and is currently consulting to business on transformation, change, performance and culture. Prior to becoming the managing director of Launching Pad, Lisa was the Chief Human Resources and Corporate Services Officer at CIMIC Group Limited, which is Australia's largest publicly listed construction company. So she's definitely got a great background with, a huge company and obviously facing a number of issues herself personally, but also organisational issues. She has been a chief executive of other construction groups as well as telecommunications companies. She's a published author on corporate culture and is skilled in strategic human resources, talent management, employee engagement, and change management. Lisa, what a mouthful. Welcome to the working world.
Welcome, Lisa.
Thanks so much. Thanks for having me. It's really a pleasure.
No worries. Now, just a quick one, I suppose, for our benefit and for our viewers' benefit. How did you actually become a champion of diversity?
I think it's really just my passion around social justice, I think. I've always really fought for the underdog, where people are vulnerable or in a minority situation where they're less powerful. And so I guess that just flowed from that natural interest of mine.
Yeah, absolutely. Mm.
Now, Lisa, I mean, COVID's obviously had an impact on everyone in every facet of their lives. For those of us in the workplace, I think probably we'll all find that the biggest change and the biggest shift has been around the workplace culture. And I wondered whether you had any thoughts or observations with your experience around what perhaps say the three biggest shifts have been in relation to workplace culture and diversity.
Yeah, sure. Look, I think the first thing, and it's a bit of a no-brainer, but I think it's worth reflecting on, is the emergence of and primacy of health and wellbeing of employees. And while I think that a lot of companies, including the one that I previously worked for, focused on safety and health of their employees, the COVID has really expanded that or blown it up into a much bigger concept, and that we see a much more robust debate around mental health as a result of the pandemic, but also things like family well-being, our financial well-being, and other elements that contribute to an employee's overall well-being. And I think that that's been a really huge shift. And in a lot of ways, because of the pandemic, has overtaken some of the more commercial drivers or primacy of commercial interests of the business. If you don't have people who are well, if you're not looking after their well-being, your clients and your stakeholders, see your performance as poor, and therefore you lose your reputation and lose your license to operate. So I think that this is an area that has really emerged from the pandemic, this culture of care for employees around their health and well-being, a much broader concept. And the trick is to see whether it will continue after the pandemic kind of falls away.
Yeah, I'm interested to see how long it's sustained as well, Lisa. It'll be really interesting.
But I think, things like agility is, really important. And again, it's kind of been talked about in a digital transformation sense, but not in a response to a pandemic. And, going into a pandemic with a non-agile business, so a business that's really a compliant business, very structured, very hierarchical, working to rules, unless they can develop some agility pretty quickly, they're the ones that aren't going to survive going forward. And so that's one. And then the other one is really around making sure that you have a culture of trust, or you can generate trust in your culture. And I think we're seeing that play out from a COVID perspective in the difference between Australia and US population response to COVID, where, Australians have been very compliant really to what the governments have asked us to do. We've been locked up for long periods, as we know. We've worn masks, we've, done all sorts of things, where in the US, that's been a bit of a struggle. And, you could really put that down to Australians being more compliant, or you could argue that we're a little bit more trusting in our governments and the science that has been brought forward through COVID. So, trust is going to be the same for businesses. If you have trust with your employees, a culture that engenders trust, then they're more likely to perform and commit themselves to helping the business grow and succeed through any crisis. So, they're the things that I think are really important.
Yeah, it's really interesting because, typically you would see trust built through face-to-face engagement, right? And so we're in an environment where we have to do that remotely. And so you lose part of that sense of building that trust. And so do you have any recommendations for organizations around, things that they can do, obviously virtually, around building that trust and getting to moving towards that agile? Because I understand and appreciate, that's not flicking the switch, but do you have any recommendations of how they can build that trust with their employees?
Just make sure that you have opportunities to ask employees, how things are going, get their feedback, and then act on their feedback. And then, tell them when you're acting on their feedback. It's that kind of, you said, this is what we've done, so say, do ratio, right? So that you're connecting, you're listening to your action, and then you're continuing getting feedback and adjusting what you're doing. And if you're really listening and you're really taking action, and people see that you are doing that, then it does help to build trust, even in an environment where you're not face-to-face.
Yeah.
Not everybody's face-to-face in a big company. It's easier when you've got a small company. So, those things apply, COVID or not COVID. Sure.
Thanks, Lisa. That's great.
Yeah, you're right. I think it's about creating the space. What I'm hearing about, from my takeout from this sort of conversation is obviously the authenticity. I think that is really, coming through, that people, employers have to be authentic to keep the trust, to keep the faith, and, really to show that you're not just an employer, you're somebody who is inclusive. And I think that there's, as you said earlier, I think there's a lot of really, big things that have come from COVID. And I like the building the electronic trust, as Keryn sort of brought up. I think that's going to be the trick. And the other thing is, I suppose just the last one from mine, is Zoom fatigue. I don't know if you get it or if you know people who've got it, but I can tell you, I think that when you do back-to-back Zooms, you can get a bit electronic, I suppose, virtually exhausted.
No, I second that, Jamie. I second that.
Yeah, well, because it's very intense. It's not like walking into a meeting. You kind of have a bit of a chit chat to see, how you're going, how are the kids, what did you do on the weekend. So you're having that kind of time. And then you can get some rest periods in a meeting because you don't feel people are watching you all the time. Whereas on a Zoom, it's very, it's very focused on a topic or on an issue or, and you're on camera, and so you don't have that kind of sense that you can relax during that process. So it is tiring. I think it is more tiring, and you have to really concentrate. Your brain's really concentrating on trying to pick up cues and, work some of the processes that would be easier if you're face-to-face.
One thing I'm interested in, though, also is that I think that there's a number of industries that have been significantly hit by COVID, and they're backpedaling and sort of trying to survive themselves. And there's huge redundancies in or people who can't work or organisations that can't work. How do you recommend with the organisations that don't have all the resources to actually implement these programs or continue these programs?
Yeah, look, I think I've got kind of maybe a different perspective to other people. I think sometimes we tend to overcook programs and make them a lot more complex or a lot more intensive than they possibly need to be. For smaller organisations or organisations that don't have a lot of resources, it is about inquiring about people's well-being in a conversation. It is as simple as that, in an authentic way, really being interested in how people are going, and how, you know, in that broader sense, how's their family, you know, how are they coping financially, you know, and are they in a situation that is not putting their health and well-being at risk? And so I think it can be a simple conversation. It doesn't need to be a really extensive program. Obviously, when you've got lots of employees around the world, you know, you need to invest a little bit more resource and be a little bit more systematic about it. But I think even small businesses can do something by just having conversations, connecting people, making sure that you're engaging with them. They feel like they belong. They feel like they're valued.
I think you hit the nail on the head with that word authentic, Lisa. I'm a big champion of being authentic and authentic leadership. And I think perhaps, you know, you're referencing authentic leadership in relation to smaller organizations and how they can look after their staff. But I think, you know, that can, regardless of the size of the organization, authentic leadership is always needed. And I think it's the shift with COVID and this focus on health and wellbeing, I think now is really going to shine a light on those leaders that are authentic and do invest the time in knowing and understanding and appreciating their staff, versus those that perhaps are just not doing that so much. So it'll be really interesting to see which leaders choose to adopt some changes in their leadership styles and start to take a focus, because of that authenticity is really needed and highlighted more than ever, to your point.
Yeah, I agree.
Now, just a question, because you know, the rest of the world is sort of moving into lockdown stage. I mean, there has been obviously Italy and Spain and you know, the UK, etc. They're going into their own levels of lockdown. I know that Melbourne, I think, went through 100+ days of lockdown where they could only leave the house for an hour for exercise, etc. Being in your previous role, managing different time zones and different states, how did you manage the lockdown in Victoria and the people there as far as their wellbeing was concerned? And do you have any tips for people who may be moving into this period at the moment?
Sure. I guess that we were a little bit different in that a lot of our workforce was still engaged in construction projects in Victoria because it was deemed to be an essential service. So whilst a lot of office workers were in lockdown, the people who were on site were still able to work. So I think, you know, there was kind of almost a two-speed approach here. And, you know, that had its own stresses. You know, it's not easy to, you know, structure workplaces that even if they're still working, that you have, you know, social distancing and you have the right hygiene factors and you have all the temperature testing and all the stuff that you need to keep going. And, you know, as I said before, you know, it's part of your social license to operate. So if you muck that up, then that's, you know, it has a really big financial impact and a health consequence for your employees. But for the people who are working in offices, you know, we had to have them at home, and really it is just about trying to, like everybody else, keep people connected. And so, you know, really amping up that connection between manager and employee, making sure they're checking in, making sure that they've got structured work programs, that they are inquiring, they are having that authentic conversation. It isn't just a transactional conversation when they get on a Zoom meeting or, you know, whatever technology that they're using. And they are, you know, trying to keep some structure, engagement and conversation going at all time with their employees, so they feel like they're still engaged in the process of work.
Okay, interesting. Lisa, on that thread, I wanted to get your thoughts around how organisations, you know, if they haven't already been looking at addressing and managing employees on their return to office approaches, and versus or even blended with that continuation of working remotely. Do you have any thoughts or recommendations for organisations that are looking at venturing into moving back to the office and doing that blended workforce?
Yeah, I mean, it's been a really interesting process, hasn't it? Because particularly in a very tangible industry like the industry that I came out of, where you've got construction and mining, you're digging holes or you're building bridges.
Yeah, there's boots on the ground. Yeah.
Yeah, you have that tangibility of what people are doing. When they're working remotely, there was a lot of cynicism around, you know, or you know, question about whether they're actually working to their full capacity because I can't actually see it. And so, it is about trying to encourage people to come back to work, but the power has shifted between employee and employer as a result of the pandemic. So where once, people were expected to turn up to work, now, where, all companies are trying to think about how they can encourage people to come back to work and be in the workplace. So that whole dynamic has really changed, and will be interesting to see how that plays out. But from my point of view, really you need to take first care of the hygiene factors and take that off the agenda. People are anxious about, are they going to be at risk getting to the office or getting to the workplace and leaving the workplace on public transport? Is the environment that they're going to be working in going to be safe? Is it clean? Are people going to be keeping their distance? What is the risk that we're trying to manage on behalf of our employees, and how do we make sure that we're taking care of that risk? It's a bit like Maslow's hierarchy of needs, right? You take care of the most basic thing. So, and you need to communicate those and be really clear about what the expectations are, and make sure that there's consistency and that the way that that's applied, so that people have trust in the environment in which they're coming to work. And then it is about this, constant dialogue, giving people the opportunity to give their feedback, to see how they're feeling, being aware of the neuropsychology differences between your employees. Some people run towards a crisis and are really turned on by it, and get a lot of energy about helping and trying to work their way out of it. Most of us actually don't like that ambiguity too much, and may take some time to get back on track. And other people might have an existential kind of fear of coming back to the office because they feel like they're at risk. And so really your messaging and your approach needs to take into account all the differences or the diversity in the psychology of your employees, and make sure that you take account of that. People who are at risk, don't force them, so you need to demonstrate that authentic kind of approach, the empathetic approach that's going to be really useful going forward through what you're going to ask people to do and how you deal with them, and make sure it's fair. Can't be rules for one and not rules not for the other.
Yeah, agree.
It's interesting, isn't it? It sort of feels a bit old-fashioned to have everybody at their desks starting at 9 and then clocking off at 5. Particularly through the pandemic, and particularly through, well, obviously we're still going through it, but particularly for people who are homeschooling. Because that I remember thinking that as soon as the homeschooling started, that's when the real pressures would come. And I know of a professional couple that have a couple of kids, and they've both, the couple have both been in back-to-back Zoom meetings, like literally the whole day. And there's been no time to be given to the kids and to help them with the homeschooling. And to your point about how people will want to return to work, just following on that, Fred, do you think that there'll be better ways that employers can measure productivity, or there's better ways that we can have relationships with people who want to work remotely? Or, we have one of our girls who wants to continue going to the gym through the day. She's found that her well-being and mental health is actually much better, that she feels that's more appropriate for her. So I just wondered if you see different systems and processes that will remain after this period.
Yeah, look, I think a lot of these concepts aren't new concepts, right? They're old concepts, but what a pandemic has brought out is the real value of them. So, we've been talking for a long time about, reducing presenteeism and increasing performance based on outcomes. So it doesn't matter how many hours that, it takes you to do it, as long as you do it, But that then requires organisations or leaders to be really good at setting objectives, being able to measure, the outcomes, having the ability to plan, and communicate and, work with their team on the output that they're coming up with. And so, that's where it really falls over. It's in that kind of whole performance management space, not about the, whether people need to be in the office or not.
Yeah, it is really the same to be working, isn't it? They could be on, doing cat videos or, surfing the internet. Who knows? Yeah.
Exactly. I mean, it's a bit different if you're pouring concrete or you're digging a hole, you kind of need to be there. But for those, knowledge workers or those people that can, work from anywhere, who cares as long as, they're keeping up their end of the bargain.
Exactly. Yeah.
Lisa, for me, there's a particular cohort of the workforce that has probably been impacted more than others in that they're a mobile workforce. So a lot of their roles are built around business travel, being in front of a client, and having that presence, but relying on, globalization mechanisms like moving around and transport. So for that workforce, they've obviously been heavily restricted. They've obviously taken up virtual connections with the rest of the knowledge workers and the office-based workers. But I guess I wonder how their health and well-being, having shifted their style of working so significantly, how that has been impacted, and whether you have any recommendations for organisations and that cohort around easing back in and future-proofing their way back into business travel, and working as a global workforce again, rather than kind of going from cold to hot, which may potentially have a bit of an adverse reaction for them.
Yeah, I mean, I think there's a couple of things there. One is that, at least from my own personal perspective, because I was a FIFO worker effectively,
right.
But for other of my colleagues that were traveling a lot, they really appreciated not traveling. I gave them more time, with their family, but it also took out some unproductive time of their actual process of traveling. So they were more productive and they could connect with their families. However, there's, some things that they can't do remotely. They need to be on site, for example, to do, a site inspection, to do a safety check or whatever. Mm-hmm. So I think for them, the task is to make sure that they're able to, manage their workload and not just jump on a plane because you can, but jump on a plane because you must. Because what you're going to go and do necessitates you being in person. And then, we had a whole lot of people who were FIFO workers on sites, in different, countries. We had a lot of expats, for example, that were in countries that were really suffering through and still are suffering, and wanted to come home. So we had a whole shift in our workforce, people who are, couldn't travel because of border restrictions or wanted to come home, and we were left with, some skill shortages. And so, we looked at different ways of how we could deal with that. One, way was to relocate people. So, if they were working and they were willing to relocate them. We looked at, promoting local people, particularly in countries where, we had been investing in the local people, but, kind of hadn't taken that next step. So putting some of those nationals into management roles, and, they did fantastically well. And then, looking at making sure that we were trying to train and build a local capacity in the anticipation that we probably won't FIFO nearly as much as we would have done in the past. It really makes you question both the expense, but also the stress on the people that are doing that sort of work and having to travel. And then, we had to do some risk management work around, changing people's rosters so that they were traveling less and more on the ground due to roster changes. So, there's lots of different ways of looking at it, but I think that it's given us pause to reflect on why we travel for business, whether it's effective, should we be doing it, and how we're going to go forward is, I think, probably a little bit more conservatively, at least for a while.
Lisa, I can totally relate to you on the FIFO working, and I was traveling, nearly every week, and the 4:30 wake ups and the drive out to the airport, and I did enjoy the time on the plane, particularly pre-Wi-Fi, when I could get through some emails on a flight to Sydney. But I got to say that when COVID, came along, I just sort of look and just go, that's madness. What are you thinking? Like this mad rush every week to jump on a plane and to get this thing. And I mean, there's obviously the face-to-face side of it, which I think is the human contact is very important. I think Zoom's obviously bridged the gap between telephone calls and face-to-face meeting, or come a little bit closer. Now, I know Lisa's got Lisa, I know Keryn's got a further question or a couple of questions for you. I just want to change gears slightly, or maybe not so slightly, but just talk about, the diversity and inclusion piece. You are a champion of this area. You are very passionate about it. And I know that there's been significant distance covered in a number of areas. Do you think that COVID has stalled the progress of inclusion and of diversity, accepting corporations and in the workplace being alive to these issues? Or do you think it's accelerating the acceptance?
I think it's probably done both, Jamie. I think, from a priority point of view, companies have been so consumed with managing COVID that a lot of the other, which, they may consider discretionary activities have kind of fallen off. And so, maybe that investment hasn't been as hard as it could have been. And certainly, you can see through reporting that, there's been a little bit more leniency in getting reports in to WGEA, for example, here in Australia. And so, so I think it's taken the pressure off a little bit. But on the other hand, I think, for companies like ours, as I said, gave a chance to people, local people who may have, not got the opportunity to get a promotion in the near future, have been able to benefit from that. And so from a diversity point of view, supporting local communities and making sure they're getting into the leadership pipeline, I think that's been great. I think the other risk is, for the, there's been this saying, if you're not face to face, you're not in the office, you don't get promoted because people forget you, right? They don't get to know who you are. You don't kind of develop those mentorships, those conversations, identify opportunities. And a lot of the jobs that potentially are, back office jobs that could be done from home or even different locations tend to be done by women. And so, you kind of have that risk of, the women doing kind of the back office jobs away from the office and not getting that face time or getting that opportunity to get promoted. And that's of concern as well.
Mm-hmm.
Yeah, Jamie moved away from the subject a little bit, but you mentioned in that last piece around the promotion of local employees in countries where we couldn't perhaps get expats in to fill that skill shortage. I just wanted to loop back a little bit in relation to immigration programs and get your thoughts on how or if perhaps they need to evolve now that we've taken approaches like upskilling locally, and whether they need to evolve to either adapt to that change in approach or address some of those diversity issues that we perhaps may have gaps in, where it be gender or otherwise. And if they do need to evolve, how you see that playing out, and I guess not limited to Australian immigration programs, but globally.
Wouldn't it be nice if, we saw this as a trigger for, really employing a diverse workforce? Somehow I'm still a bit skeptical. It kind of moves at a pace that isn't, really satisfying from my point of view.
Sure.
But I guess it depends on what, governments do in terms of their immigration policy, their border restrictions, their vaccination approach, whether, vaccination is a requirement for moving around. So, we're going to have to be a little bit patient to see what happens there. But I think that given that companies will see moving people around as having some risk, risk of bringing infection, having quarantines, delays in immigration, depending on how the governments sort themselves out, then, it may be an easier pathway to train, invest in local talent and employ them. And if we could expand that to thinking about, people of different backgrounds and gender and, all the other diverse groups, that would be a bonus, and certainly should be an opportunity.
So just on that point with the added complexity that immigration, has brought about. So not only is it, can I get the visa? It's can I get the travel restriction, and do I have to quarantine for 2 weeks? Do you think that companies will move away from the global mobility model, or they'll, still persevere with trying to source talent from overseas?
Look, I think it depends on the industry. Like for the industries that I was in, we have a definite shortage here in Australia. We're just not producing enough engineers, for example. You and I have had this conversation before, Jamie, that, we actually need to, if you've got an infrastructure agenda and you need engineers to do the work, then you either need to think about a different work model. So the future of work has a role to play here in digitization, and can we use AI to do some of the work that has been done? Can we use automation? Can we offshore, and have a more 24-hour, 7-day-a-week kind of approach to some of the tasks? Can we redistribute some of the engineering tasks to other people? So it is, kind of dependent on the industry. I think there's certainly going to be still a role for select immigration based on critical skill demand, but I think it will be, really thought through a little bit more carefully, a little bit more, less demand on the behalf of the companies, and probably, with some restrictions from the government, who are probably a little bit conservative in managing their COVID exposure until there's, adequate vaccination of populations.
That vaccination point is really interesting, and it's a beautiful segue to my next question, Lisa. And it's around, it's crafted around business travel, but I guess probably more broadly the vaccination topic itself. What do you view would be an organisation's best practice model for managing, staff vaccination? Not necessarily rolling out the vaccination, but managing that blend between people who are obviously supportive of being vaccinated and those who perhaps aren't so much, and the lack of information that we probably still all have at this point around the vaccination products and the protocols. Do you have any thoughts around that you would refer to organisations around how to manage that vaccination program?
Yeah, I think it's going to be really interesting, isn't it, to see whether you can enforce vaccination and it not be seen as an impingement on somebody's human rights to choose. Mm-hmm. So I think, it's a kind of a bit of a minefield for organisations to be enforcing it. Although I think that if somebody was, their job was to be going to, different countries, and, they had to do that, and then, that would be a requirement, I think, of that particular job. But as a general principle, it'd be hard to enforce. And we don't enforce things like influenza vaccination, albeit that it's a different impact of that virus. So I think, it is about education, it is about communication, it is about, doing that whole change management stuff. As I said before, none of these principles are kind of new. So, where do you get leadership to role model having the vaccine? Your peer influencers, pick them out, have them, I guess put a bit of peer pressure on, show that it's okay, provide it for free, have it in your office and at easy access, and so it is, trying to bring that change management discipline to a problem that, is just a new problem.
Do you think that it is the role of the employer to be, pushing mandatory requirements of vaccine, or is it more a governmental sort of, situation that you could point to? Rather, so you brought up the person who was traveling a lot of countries, maybe they need to get the vaccine as per government regulations. I just find it, as you mentioned, you said that people don't mandate that you have to get the flu vaccine. And so now, is it the role of the employer to actually be the one who polices it and who tries to enforce it, or is it a government conversation?
Well, it could be the airlines too. It could be the service provider who says you can't get on our planes unless you've been vaccinated. So that's going to be problematic if you have to travel. So I think, you wouldn't, from my perspective anyway, you probably wouldn't want to be at the bleeding edge unless you were an airline and your people were at risk, and you do have to provide a safe work environment for people, and in that instance that's a high risk environment, so they may have a different case. But in a general sense, it would be an interesting conundrum to enforce vaccination. I would prefer to see what governments require, look at the specific job requirements, and then take a change management approach and encourage as many as possible.
Yes, we obviously have a bit of a precedent in relation to child vaccination, certainly within Australia anyway, with the no jab, no play aspects of that immunisation program. But I guess this is at a far broader level. And I agree. I think that the risk tolerances around organisations are obviously a lot lower than they were. And when it comes to vaccinations or business travel, those two are very much going to be interlinked moving forward. I wanted to get your thoughts around what you thought the world would probably maybe look like in, say, 12 months' time, now that we're all getting the messaging that probably international travel is not going to happen this year, much to some of our disappointments. But do you think 12 months' time, when the international borders perhaps open up and we start to see some green lanes or bubbles, as they call them, do you think there's going to be a hesitation around travel, or do you think everybody's kind of going to run for the borders and make a dash for it?
Well, I think, it's a bit like I was saying before about the neuropsychology. I think that, some people would take the risk and go now if they could, So, there are going to be some early adopters moving quite quickly. And then, the rest of us will kind of see what happens and follow in a bigger bucket. And then, you'll have people who'll probably never travel again. So I think from a business point of view, probably the same. If it's essential, if it's in a bubble, if it's going to New Zealand is a different prospect than going at the moment to the UK or to the US. So if you can manage that risk, and just to see how that whole obligation of employers in providing a healthy and safe work environment. And whether there's any precedent cases for, employers who, sue their employers for not providing that due to COVID. There's a bit of work to be done to see whether you can, say everybody's going to jump on the plane and take off overseas straight away. I don't think so.
Yeah. I'm kind of envisaging that the onboarding experience when it comes to joining an organisation will be expanded around asking those questions around, are you comfortable travelling, because the landscape has completely changed. So yeah, it will be interesting to see which organisations or which sectors adopt that, and which it's probably more inherent given what they do and where their people go. So yeah, it's interesting stuff. Thank you, Lisa.
Sorry, Lisa, I was just going to say, when you said there's, some people won't travel again, that just really drove a dagger through my heart. God, not being able to get on a plane and go and explore, the world, or take my family, or, to see people I know overseas. I suppose that is a reality. As you said, for some people that's their new reality, and they'll just make a choice that they don't want to do it. But also what you've been talking about is really it feels like we're starting to peek into Pandora's box here. And I certainly, for one, haven't turned my mind to the potential impacts, the potential legal ramifications, to the potential discrimination cases that could be brought up by, I say, well, Lisa, I don't want to do the vaccine. I don't believe in it. I'm more than happy to take on the job. And so will I get overlooked because I don't take it? I think that there's a whole, industry waiting to manage, what's going to happen after, and how to navigate this really complex area, because I could just imagine the debate is going to be fierce. I think that as I said, this whole fighting for the people who genuinely believe they don't want to get the vaccine and therefore missing out on promotion. It feels like it's a whole new game.
Yeah, look, I think so. I think it's, and can you ask? You know, in our business, you know, we often require people to have medicals. But, you know, in other businesses, you may not be in that same situation, or you might have to restructure the way that you hire people. But, you know, it's going to be really interesting. And again, you know, it is going to, you know, require a test case or somebody to you know, test out the legal situation to understand how it's going to play out.
Lisa, this has been extremely insightful. We appreciate your time. I know the mobility community at large appreciates your time and your insights. And I'd just like to thank you. I think it's been great. I think there's been some really good takeouts, you know, for me personally, and I know for lots of people. So thanks so much for your time.
It's a pleasure.
Yeah. Thank you, Lisa. Really appreciate your time.
Bye-bye.